Good morning, everybody. Thank you for attending this morning's town hall with Congressmember Jimmy Panetta on protecting health care. And welcome to Cabrillo College. My name is Adam Spickler, and I'm in my 7th year as a trustee for Cabrillo College. On behalf of the college, I'm proud to welcome you here to Samper Hall and to our Aptos campus. I imagine most of you came here today hoping to ask questions or voice concerns on one or more of a myriad of pressing federal rights, issues, or programs under attack from the current executive branch. If, like me, you are a transgender, queer Jew who volunteers on the governing board of a beloved institution of higher education, and that administers federal entitlement benefits to all of our county's Medicaid, CalFresh, and CalWorks recipients, and who has close friends or loved ones living with chronic health or mental health issues, as well as folks who are in varying degrees of getting legal documentation together as immigrants, or as somebody who has read swaths of Project 2025. You've probably showed up with questions that you'd like to ask or concerns you'd like to share, outraged at the attempts of the executive branch and congressional Republicans to undo or eliminate our agency's funding research rights and safeguards. Today we have the unique opportunity to hear from Congressmember Panetta and his guests on the topic specifically on healthcare and the Republicans' proposed $880 billion in cuts that holds the potential to slash Medicaid and other critical healthcare services. Yes, I mean, let that sink in. $880 billion worth of cuts. After this discussion, you'll have an opportunity to ask questions on this really incredibly pressing topic and other topics of your choosing. And staff for the Congressmember, Emmanuel and Aaron, will have microphones and will be taking questions from the audience after our panel conversation. But first, I am extremely proud to introduce our member of Congress, Jimmy Panetta. Congressmember Panetta was first elected in 2016 and proudly serves his 5th term as as the member of the 19th Congressional District in the U.S. House of Representatives. Congressmember Panetta serves on the House Committee for Ways and Means and the Budget Committee. He also serves as Chief Deputy Whip and is a member of 44 congressional caucuses. He is a busy guy. 16 of which he co-chairs and 3 of which he founded. The 19th, important to note, the 19th Congressional District includes all of Santa Cruz County minus the city of Watsonville, as well as portions of South San Jose and Santa Clara County, the coastal half of Monterey County, and northern San Luis Obispo County. Since February 1 of this year, Congressmember Panetta has held 13 town halls, 8 of those in person, 5 of those virtual, making today's town hall his 14th in a very short period of time. Congressmember Panetta's town halls have included topics like today's on Medicaid, Social Security, and cuts to federal workers and federal research and funding. He's held listening sessions with recently terminated federal workers and with nonprofit leaders, and he is here to share information on healthcare cuts and to listen to the concerns of his constituents today. It is my honor to bring up Congressmember Jimmy Panetta.
Spickler. Appreciate, Adam, everything you do for Cabrillo. But it's amazing, every place you go to in Santa Cruz, if there's a community event, Adam is always there as well. So truly appreciate that. And it is great to be back on campus here at Cabrillo College, especially as an alum of, what I still call them, a junior college, Monterey Peninsula College. This is one of 3 community colleges that I have in the 19th Congressional District. Let me thank President Matthew Wetstein, who's here, I think, somewhere. If not, I'm going to see him later today. Let me also thank Morgan Miller, the head of the Performing Arts, that made this happen. We're going to get to our experts, but I just want to thank them, Dr. Hernandez, Dr. Adala, and Ms. Aguirre. And yes, thanks to all of you for being here. For being here not just today, but let me say every day up to 2026, okay? It's not going to be easy. We know that. It is going to be challenging. But the fact that you are here says a great deal about you, about this community, and why it is the foundation of how we are going to move forward together. Now, before we get started, I'm going to ask something of you, and that's for a moment of silence. In the United States Congress, we lost 2 members of Congress over the past 10 days. Sylvester Turner, Raul Grijalva from Arizona. We also lost the former chairwoman of the Appropriations Committee, Nita Lowey, and on a personal note, I lost my mother-in-law last Sunday. So if you could just take time with me to just take a moment to reflect, I'd appreciate that.
And maybe the 15,000 Gazan children we could also reflect upon.
Thank you. I appreciate that. Now look, Sylvester Turner, a member of Congress, he had a saying that if you got fuel in your tank, you don't park your car. As you heard from Adam, this is my 14th town hall since February 1st. Public town halls, telephone town halls, I gotta say, it's probably more than the entire Republican conference has put on. It's a lot more. It's a lot more than many of my Democratic colleagues. So literally and figuratively, my car has been anything but parked, ladies and gentlemen. The 19th Congressional District is big, so I've been driving my car quite a bit, up and down the 19th Congressional District, doing town halls throughout the 19th Congressional District, but it's also why I do telephone town halls. Please understand this, to reach all parts of this district, and to be able to have certain guests on those town halls, which will allow them to kind of zoom in or speak in from different parts of the country. Now, what I've heard throughout my town halls, what I hear throughout the 19th Congressional District is absolutely understandable. People are angry, people are frustrated, and yes, people are fearful. You want to do something, and you also want to know what to do. Now, there was an interview on Sunday with John Stossel on This Week with Stephanopoulos with Bernie Sanders. And they asked him, "You're saying fight back, what do you need?" And his response was, "Well, that's the question, and we're working on that answer." Ladies and gentlemen, that's not my answer. As much as I respect Mr. Sanders, the answer is we have to win. But in order to win, we have to be strategic. In order to be strategic, we have to have knowledge and information. And that is why I'm doing so many town halls. That is why I'm active on social media. That is why I'm sending you newsletters sometimes 3 times a week to communicate with you everything that is going on. Everything that this administration is doing to challenge our Constitution and destroy our democracy. Everything that the Republican majority is doing to cut Medicaid. Everything that we in the minority are doing in and out of Congress. And everything so that you can have information so that together we can be strategic and we can win. Now, this is an official town hall, so I can't be too political in what I say, but I have ways to get around that to a certain extent. But I do want to provide you with information, especially what this administration, the Republican majority, Elon Musk, and Doge are doing to gut Social Security, to cut Medicare, and to cut Medicaid. That's why I'm doing this Medicaid town hall with these experts. It's why over the last week, I did a Social Security town hall with former SSA Commissioner Martin O'Malley. I hope you tuned in for that one. He really was able to highlight what is going on in the Social Security Administration. We had a meeting with him. The Democrats on the Ways and Means Committee had a meeting with him 3 weeks ago, and he kind of just laid it out there. A lot of information that we don't know what's going on with our Social Security. He was able to highlight that. Now look, I realize that this president has said that he won't touch Social Security. But then on the other hand, he's saying there's widespread fraud. He's saying that millions are being given out to the dead and undocumented. And Elon Musk even called it a Ponzi scheme. But let me tell you from the facts that Martin O'Malley talked about, and according to an IG report, it found that from 2015 to 2023, less than 1% of Social Security payments were improper. Now, yes, there were mistakes that were being made, but they were overpayments, not payments to the dead and undocumented immigrants. However, what we do know is that undocumented immigrants are paying into Social Security $22 billion. Now, look, we can all agree, especially if you call that 1-800 number, that the SSA services need to be improved. But if there's fraud, waste, and abuse, we need a plan to get rid of it. It needs to be surgical, it needs to be careful, it needs to be tactical, and it needs to be transparent. Instead, we have Donald Trump allowing Elon Musk and Doge to overhaul the Social Security Administration with a chainsaw. Now, the Wall Street Journal, of all papers, the Wall Street Journal even wrote this week that the SSA has already a 50-year low of staffing, yet it's serving an all-time high of recipients. And so they said it's barely hanging on, and it could get worse if the administration follows through with its plan to cut 7,000 jobs and close 47 field offices. O'Malley said if that happens, that will guarantee a system collapse. So why the hell is this administration doing this? This administration is doing this, I believe, in my opinion, because they want to cripple and crater the SSA. They want to turn the public against it, and that gives them a green light to privatize it. That's why they're doing this. Now, we talked about the solvency issue up in 2035 of the SSA, and that can be fixed if we remove the earnings cap of the highest earners and give that to the trust. But we're not doing that. We're not even talking about it. Instead, this administration, Elon Musk and Doge, are wrecking it to rob it, as O'Malley said. Wrecking it to rob it. But this is where we're at, ladies and gentlemen, with this administration, with Elon Musk, and it's why you are here today to get information. That's just part of my job in my service to the 19th Congressional District. Now, as many of you know, as a federal representative, my job is to make the federal government work for you. That's why I'm a Democrat, because I believe that the federal government can help people, not hurt people. And I've seen that throughout my life, that it's been able to do that. I've seen that throughout the 8 years, and the proud 8 years, and the humbling 8 years I've been in this position as a U.S. representative. That's exactly why on November 6th, I held a meeting with my staff. And I basically said, look, coming up here, because a lot of them did not serve in Trump 1.0. And I told them, look, you're going to have a lot coming at us over these next few years. A lot. It's going to be overwhelming. But please, please do not get distracted in our obligation to serve the constituents of the 19th Congressional District, because that is what you, the constituents, deserve. A representative who understands what it means and what it takes to get government to work for you and not get distracted. Now, at the same time, though, we can walk and chew gum, and then we will continue to fight back and make sure our system of checks and balances is strong. As proven, I can walk and chew gum at the same time. And I have to in this district, which, as you heard, is a very, very big district. And I'm going to tell you what it entails. Again, because many of you, I'm sorry to say, in my experience going throughout the 19th Congressional District, still don't know the boundaries of the 19th Congressional District. Raging Waters up in San Jose. You guys know where that is? Lake Cunningham. That's the northernmost part of our congressional district. It then swoops down through San Jose, South San Jose, up over all of Santa Cruz except Watsonville, which unfortunately got gerrymandered out. It then goes down the Monterey County coastline all the way to Cabrillo. You hit Cambria, and then you take a hard turn east, with Atascadero being the most southern town, all the way out to the Kern County border with northern San Luis Obispo. It looks like a big L or a banana or a crescent moon, whatever you want to call it. It's a big district. It's a diverse district in so many ways. But it's a dynamic district, and it allows me to basically really employ the balance that I need to do as a U.S. representative. It is not a monolithic district whatsoever. And so I make sure I do that by governing 3 pillars. Legislation, making sure that we continue from the federal angle to work on the top issues in Washington, D.C. for the 19th Congressional District: affordable housing and Medicare reimbursements, environment and immigration reform. Funding, that's the second leg, making sure that there are funding for our infrastructure projects. And third, casework, making government work for you. If you have a problem with the federal government, please contact my office. If you have a problem with the Veterans Administration, with Social Security, with IRS, with getting a passport the day before a trip, which can be tough, but we've done it before thanks to my staff. We've done it before. Those types of issues, please know you can call my office, and please know we do everything we can to help you, because what I've seen is that's how we're able to affect people's lives. The fact that people come up to me today and tell me about the work that my office has done for them at a personal level to make federal government work for them, it shows you how impactful we can be. That is my job. That's my responsibility, to serve my district. And what we've seen is that the constituents of the 19th Congressional District appreciate that. It's why that I got close to 70% of the vote in last election. It's why, according to the ballotbook.com, that I was the #1 overperforming Democrat in California out of 43 races. The #1 overperforming because I believe that good governing is good politics. And as I've always said, I will work with anybody that helps me serve the 19th Congressional District. But I've always said I will also fight anybody that takes away and threatens our values in the 19th Congressional District. And when you have an administration and Elon Musk who are wrecking government, weakening government, and making it so you don't get the services that you pay for and that have been earned, that is when I will fight anybody on any side of the aisle. Absolutely, government has waste, abuse, and fraud. We know that. And it needs to be found, it needs to be prosecuted, and it needs to be reformed. But you cannot allow Elon Musk to take a wood chipper to it, to wipe out workers, to wipe out the system, and allow access to our personal information to do that. The government and its systems will seize up, and you will not get the services that you deserve. You break down our institutions, that's when you break down our democracy. That's why we are sounding the alarm, and that's why we are fighting back. Now, making sure our system of checks and balances works is the most important way we can do this. And I admit, and I know you know this, it's not fast enough. Got it. I get it, okay? The Congress and the courts do not act as fast as the executive branch. And the president knew that. Why do you think he put forward 72 executive orders in the first month of his administration? Over 90 orders, executive orders total. They want to flood the zone, or as the president Svengali, Stephen Bannon said, they want to have this muzzle velocity that put us on our heels. And I know you would know that. I know we know that. It did put us on our heels. It took us a while to basically get our footing and start moving forward. But these are the consequences of the last election, and he feels that he's in a position to govern the way he wants. But he cannot do that in a way that's unconstitutional. He should not do that in a way that's destructive, and that is why we're going to put this in. Now, there are 5 ways we are fighting back, ladies and gentlemen. 5 pillars, as I call it. Legislation, investigation, litigation, communication, and mobilization. Let me repeat that. Legislation, investigation, litigation, communication, and mobilization. Okay? Now, hopefully you grabbed a sheet on the way in that you got it right in front of you. I see it right there. That lists everything that we're doing in those categories. You see the number of areas of pieces of legislation that we've authored and introduced to fight back on this administration. You've seen the number of letters of inquiries that we've sent to this administration to demand transparency in what they're doing and their destructive efforts. The problem is, ladies and gentlemen, is that you have a president who's in charge of the administration, so we're not going to get our letters answered. You have a problem in that we are in the majority. Democrats are in the minority. It takes 218 votes out of 435 to pass legislation. Guess how many Democratic members there are? 215. We're in the minority. We don't have enough to pass this legislation, and Speaker Johnson will not put those pieces of legislation on the floor. So we're left with a Republican-controlled Congress that is showing absolute acquiescence to this administration and abdicating its role under Article 1, Section 8. Now, the good thing is that agencies and spending by Congress can only be abolished and stopped by Congress, and that is what is being reinforced by the courts. That's why our litigation pillar is so darn important right now. There have been 130 lawsuits that have been filed, and we may not win all, but man, you look at that list that I gave you, we are winning many of them, especially on the important issues, with enjoinments and TROs and injunctions that have been filed. Now, I know what many of you are thinking right now, because I've heard it over and over. What happens when Trump ignores the court orders? What happens? Like he did last weekend with the Alien Enemies Act. The fourth time in U.S. history he has employed that act has been put into effect. Now, what the AEA says is that you can't deport people if you're in a war and you've been invaded or there's a predatory incursion. His theory is that gang members need to be removed based on the AEA. The court stopped that removal. Yet, 3 planes still took off. 3 planes still took off. Trump is very shrewd in picking its political targets. We know that. He wants to remove gang members and the legal process be damned. He wants to make safety the priority over the rights of violent thugs, and he wants to move them beyond the reach of the U.S. law and process. But we have a process in this country. Trust me, as someone who was a court officer for nearly 20 years, it's called due process. Judges want to uphold due process, and let me tell you, as someone who's married to a judge, judges do not like being ignored at all, okay? So this judge got ignored, and that's why he ordered them to show cause. It's why he then stopped basically the use of the AEA at this time. That drew a rebuke by President Trump calling for this judge's impeachment, if you can believe that. Now look, we've impeached judges before in our history, but they're for being drunk on the bench, they're for being criminals and for taking bribes, not for disagreeing with a judge. That is the appellate process. That's what you use, and that's why there was a rebuke by Chief Justice Roberts. Now, to me, that shows that the Supreme Court is going to be receptive to pushing back as a bulwark. And the ways that courts can push back are with fines, with penalties, with sanctions, and yes, with arresting the attorneys for non-compliance. Now, the thing basically is communication and coordination. That's why this is so important. That's why I'm doing these town halls. And then ultimately it leads to mobilization, to hold this administration accountable, but more importantly, to mobilize those constituents in other districts who have representatives to hold those representatives accountable that support these types of matters. That's the most important thing. Now, I want to address a couple more things until we get to our experts and get to questions, because I believe we have to have this information out there. I want to talk about the continuing resolution vote that was done 2 weeks ago. As you know, I voted no. I voted no for a number of reasons. Because Republicans stopped negotiating with Democrats 3 weeks ago. They basically said, got up from the table and stopped negotiating. That's not how you legislate. Number two, There were cuts in this bill to infrastructure projects, agricultural projects, food programs, NIH, and rent subsidies. 3, there was no funding for disaster relief. 4, it expanded the authority of the executive branch by putting money into large buckets rather than line iteming it. Therefore, that gave the president more authority to determine where the spending does and does not go. That's why I voted no. Unfortunately, the Republicans were able to come together and pass it in the House. And boy, did it put Chuck Schumer in a tough position. It put Democrats in a tough position because either you had to vote for that bill or let there be a government shutdown. And the problem is, ladies and gentlemen, is that this wasn't going to be an ordinary government shutdown. I've been through a government shutdown. I've been through 2 back in 2018 and 2019. And let me tell you, I do not like government shutdowns. They're horrible because people and families get hurt with government shutdowns. But they try to do, during the shutdowns, you try to do stuff to remedy the situation. Call them essential workers, get them back to work while we start to negotiate. This administration would not use those tools. We know that. Instead, they would use it to their benefit and to their advantage to chip away at our institutions, to weaken them even further than they're already trying to do. So it was a lose-lose situation. The problem is that Chuck Schumer's messaging was absolutely horrible on this. He didn't make the situation clear. It led to a back and forth. It led to an incoherent message, and it left people pissed off. Got it. And unfortunately, after the vote, it left the focus on the Democratic infighting. It became a distraction from President Trump abandoning Ukraine, a distraction from administration officials sharing classified information, making these crazy, inconsistent terror policy decisions, these random firings, rehirings, and reckless cuts. It distracted people from knowing that this country is going in the wrong direction. Consumer confidence is down, the stock market's down, jobless claims are up, inflation's up, egg prices are up, grocery prices are up, measles spread is up, bird flu spread is up. But ladies and gentlemen, we still have time to ensure a unified message, especially when they have a national security team who's basically spreading classified information over Signal and text, especially with the upcoming reconciliation package. Basically a package in which they are planning to cut essential services like Medicaid to pay for cuts for billionaires. Right. This is why we're here today. Because what this reconciliation package is just an extension of the tax cuts of the bill that was passed back in 2017, the Tax Cuts and Jobs Act, TCJA. Once again, they passed that through a reconciliation process. So what is reconciliation? All it means, ladies and gentlemen, you have to pass it through a majority in the House. Got it, check. That's what they used to. That's what you always do. But in the Senate, they don't have to abide by the 60-person filibuster. All you need is 51 members of the Senate in the filibuster. So it can't be a purely partisan process. The issue that you're going to see over these next few weeks is how you pay for these tax cuts for billionaires. There are ways in which they're going to do it. First and foremost, what I think it's going to come down to is debt and deficit. Basically having our sons, daughters, grandsons, and granddaughters pay for this bill. And you're going to hear this more and more. So I want to get this in you and for you to start thinking about this. They're doing it through this process called baselining, okay? And what baselining is what their theory is. It's a gimmick. What their theory is that the TCJA cost $3.7 trillion. Their theory is that because the TCJA is current policy, it's going to get extended, therefore it shouldn't be a part of their bill. You see what I'm saying? I know, it blows your mind, but that's the thinking that they're saying. Once again, $3.7 trillion, part of current policy, it's going to go forward anyways. What they're saying, if they pass this bill, therefore it shouldn't be part of the bill. It's ridiculous, but that's what they're trying to say in order to put that 3.7 into our debt and deficit. The second way they're going to try to pay for it is through tax revenues and the growing economy to help pay. They are saying that the economy is going to grow by 2.6%. They're going to get tax revenues. That's going to help. All the experts say the economy is only going to grow by 1.8%. Third, this is why we're here. Because they've asked committees in Congress to cut their budgets. And one of those committees they've asked to cut, as you heard from Adam, is the Energy and Commerce. $880 billion in cuts. Now, Energy and Commerce has purview over Medicaid and Medicare, and they have a $25 trillion budget. If you cut $880 billion with a B from that budget, and then 98% of that $25 trillion goes to Medicaid or Medicare, guess what you're gonna have to cut? Medicaid or Medicare. Now, what they've said is that Medicaid has had waste, fraud, and abuse. Once again, they're using this as the excuse. But let me tell you, and as you're going to hear, it's going to be very, very destructive for the families here on the Central Coast. Why I voted no for the Budget Committee resolution for this reconciliation package. Why I'm communicating with you about it, why we get mobilized about it, to ensure that if there are any members of Congress who are supporting these types of cuts, they need to be held accountable. That's why we're here today, ladies and gentlemen, allowing me to provide you with information and facts, allowing me to hear from you about how reckless, how mindless, and how destructive this administration and Speaker Johnson are being, but also how beneficial these types of programs are to you, and that we have the receipts to prove it. Going forward, it is not going to be easy, as I said from the beginning, as these are very divided and destructive times. It won't be easy for you, for our families, for Democrats. It won't be easy for our nation. But what I can say, and I think what we know, is that the United States doesn't do easy. When you ask people to tell you about a time that made them who they are as a human being, it's very rare that they talk about a Hawaiian vacation, okay? It's usually those times that they went through that were really hard. Moments that can carve through you to the basement of who you are. And it's at times like this that we see ourselves in a profound way. At times like this, we can be either broken or broken open. We know that we can do better. But despite the narcotic of nostalgia, that feeling that we love to think about the good times, tough times are the rule in this country, not the exception. But it's what we do during those tough times that break us open. When you look back at our history, it is sobering. It is a sobering reminder that protest, divisive politics, and partisan rancor have been near constants in the United States. But we've grown as a country, not through a happily merry ride, but through the process of rupture and repair. We realize that we are not perfect in any way. However, our imperfection allows us to strive to be that more perfect union. That's how I look at this job as your U.S. representative. That's why we're here today. And together, ladies and gentlemen, that's how we must move forward. And some of the people that are going to help us today are our experts to talk about this issue of potential for cuts to Medicaid. I'm going to allow them a few minutes to give a summary of why it's important that we continue to push back on this administration, the importance of Medicaid, and why they will be damning and damaging to our Central Coast if that happens. I'm going to start off with Dr. Donaldo Hernandez, who's been a stalwart champion for all things related to health throughout his career. He's a past president of the California Medical Association, and he's one of the longest-serving hospitalists in Santa Cruz County. Prior to joining the CMA Executive Committee as president-elect, he was elected to 2 terms as president of the Santa Cruz County Medical Society. He also has served since 2016 as the chair of CMA's Justice, Equity, Diversity, and Inclusion Committee. Dr. Hernandez, thank you so much for being here. Give us a sense of why Medicaid is so important and why we need to do everything we can to protect it.
Is this on?
No.
Green light? Great. Thank you. Thank you, Representative Panetta. So these are the facts. 1 in 3 people in Santa Cruz County is on Medi-Cal. That's a third of our population, right? When the pandemic occurred, and when we stop and think about the pandemic in real terms and what happened in this county, and I am on staff and I have staff members here, physicians that are here. We worked at Dominican Hospital and at Watsonville Community Hospital during the pandemic. And it was that population that was devastated by what happened during the pandemic. In fact, over 70% of the admissions to Dominican Hospital for COVID occurred in those 2 zip codes in our southern part of our county. We almost lost Watsonville Community Hospital when venture capital bought it. And the fact that this community rallied to repurchase that and make it a public asset again really cleared that why this is important to this community, both in Monroe County and Santa Cruz. I'm glad you're applauding yourselves, because the fact that you stood up and you said this is an important asset for the people of this county really says a lot about our values on the Central Coast. Absolutely. The thing that we have to recognize, though, is that the healthcare finance is not an inelastic thing. If you take something away from something in the overall global of it, you're going to have to pay for it in other ways. And how do you do that? By increasing the amount that the insurance sector, the public insurance sector, the commercial insurance sector pays. More out of pocket for what you have, more expensive medications. What's really going to happen is your deductibles will go up. And so many of us are now seeing $5,000, $7,000, and $10,000 deductibles with insurances that we're getting from our employers. That's not a sustainable system for anybody, particularly where we live here, which is an expensive place just to live, to purchase a home. The other thing we're struggling with is recruiting doctors. The needs analysis that's happened both in Santa Cruz County and Monterey County for primary care physicians is telling us that we are so far behind the curve in getting physicians here. And the reason is because it's a challenging place to practice medicine. It's a challenging place to purchase, particularly given the fact that medical students are coming out of debt with, in some cases, $200,000, $250,000, and $300,000 worth of debt on average. And we want access. This whole thing is about access. The framing of this has to be around access. When we recognize that access issue was a problem, the people of the state of California voted in November for Prop 35, which was an example of the values that we represent. Medi-Cal was important, to the point that every county, save one in the state, voted in favor of Prop 35 for the extension of and moving those monies that were originally in the general fund to explicitly fund the needs we have with the Medicaid population. Again, 67% of the state's population raised their hand and said, yes, Medicaid's important. It remains important because it affects everything else in our system. There was an op-ed this Sunday's New York Times talking about the fact that actually Medicaid is a middle class value, because with Medicaid it allows your kids that turn 27 and no longer have insurance, they come off your insurance. What happens to the kids that are going to school? They don't have insurance anymore. Where are they going to get it? They're going to get it through Medicaid and Medi-Cal. Older folks that lose their money or lose their job, what are you going to do? You're going to go on Medi-Cal. And what happens when you have to go to a nursing home and you have no resources? You're going to be on Medi-Cal. You're going to get your care because the state's paying for it. Dental care. I've seen one of my colleagues from the emphasis here. Crazy important in terms of the overall health of people. And so supporting those interests and making sure that we have behavioral health embedded in our system is going to be paid for largely because of Medicaid and Medi-Cal. Those are the values we need to have to support, and that's why it's so important that we lean in on the very things that, I'm going to call you Jimmy, sorry, he's talking about. We want to make sure that we have a bulwark against what's going to happen, and we know that we need to keep pushing on particularly those vulnerable members that can be reasonably talked about with from the other side. The Republicans in those districts that have a preponderance of Medicaid recipients in their counties, in the state of California, and really nationwide. Part of that is the network you can do to other people in other states that also feel the same way you do, and networking and talking to their representatives about how important it is to preserve Medicare and Medicaid. That's the other piece to this. 52% of the state's population is either on Medicare or Medicaid or duals. 52%. That means that the overwhelming majority of people in this state are on some governmental form of insurance. You destabilize both of those, and you destabilize the entire environment, so nobody gets delivery. Now you start overloading the emergency departments, and again, my colleagues know this well, because we all work in the emergency department at times at the Dominican Hospital. You see those numbers line up of people that have chronic conditions that could have been better served in the community, now getting those treated in the emergency department. You have a stroke, you break your leg, your kid falls off a roof, whatever. My kid fell off a roof, that's why I can say that. You are now going to know, I know, skateboarders, what are you going to do? But the point being is, now you overload the emergency departments who are not equipped to handle these chronic conditions, and now those beds are filled with other individuals, and it bogs down the entire system. And on the backside, when you're trying to discharge somebody to a nursing home and they don't have resources, now you're struggling also to meet the throughput, so it serves everybody in the community. This is a community asset, and we have to view Medicare, and again, HR 897, I'm going to throw that out there for you to also talk about, in understanding that the system needs an influx of investment, and that resource allocation needs to be prioritized in terms of healthcare. That's really where I come from, and that's where I think about it. So thank you for this opportunity.
Dr. Ananta Adala, she's awesome. Okay, you'll see. It's because of her passion and because of her long-time work as a pediatric endocrinologist and physician scientist addressing disparities in pediatric type 1 diabetes management and outcomes. As a physician with a background in pediatric endocrinology, epidemiology, and behavioral health, she aims to build an evidence-based approach to addressing type 1 diabetes disparities by systematically evaluating youth, family, provider, and system-level barriers to optimal diabetes care in youth from low socioeconomic and racial ethnic minority groups. Dr. Adala.
You know, I don't currently live, unfortunately, in this congressional district, but boy, is my heart here. So I am a former banana slug. And I also did outreach clinic down in Monterey and in the Salinas Valley, and that is where a lot of my heart and why I'm in medicine. And so why does Medicare matter? I wear a few professional hats, as you heard. I'm a pediatrician, and I also take care of kids with chronic diseases like diabetes, thyroid function, and other more complex things. For those of you excited about receptors, come talk to me afterwards. We won't bore the general audience. But you can, and I'm a scientist, and so I've tried to really understand. I've noticed, actually, I'm going to go back to my childhood a little bit, not for too long, and I remember that there kept being narratives that we were told, right? Ideals that we want to hold ourselves to as people. And yet we kept doing things, right? The adults in my family, the policies that existed that seemed to directly counter what we intend to be as humans. And so when I think about something like Medicaid, this is right at that same intersection. I can't care about child health without caring about Medicaid, and that is always my approach. Well over around half of the children in the United States are touched by Medicaid, if not more. And I think the narrative that's often painted around Medicaid is that it is really for those folks who are low income only. And I think it's really important to rewrite that narrative, coming back to what do we say versus what do we mean. As somebody who takes care of kids with chronic diseases, I'm often actually working with middle-class families where, if any of you know what type 1 diabetes management is like, it involves sensors, it involves technology, it involves things that are expensive, it involves insulin, which is also quite expensive. And in order to be able to have your child live, thrive, be healthy, live out their potential, be a tax-paying member of society in the future, you have to offer them technology, you have to offer them adequate treatment. And if you don't, then you run into this issue. And so for our middle-class families, all of this ends up costing well over half of their income. And that's where Medicaid comes in. So I think it's really important we understand that when we're talking about Medicaid, we're really talking about all of us. We're talking about myself. Many physicians are also trained with support from Medicaid dollars. And so in order to understand how far-reaching Medicaid is, it's important to rewrite this narrative, and I cannot underscore that enough. And that's what I've spent a lot of my scientific world doing, is we say certain things. Can we really just pin that down? Can we understand what we actually mean by it? And then we can be precise with our words. So when we say we support Medicaid, what we're saying really is we support child health. We support the health of people as a whole. How many of you have heard of that really old adage, a rising tide lifts all boats? Have you heard that? Okay. Yeah, you can't be in Santa Cruz and not know some waves, right? So what I love about that is it reminds us about how we should really orient our policies and how we should think about it. So, and I'm gonna not bore you again too much with data, but there is this one very beautiful study that was done. And they essentially said, if people who didn't receive diabetes technology, because that's the world I live in, if we were able to normalize it and make sure everyone had the same access and the same utilization, because access isn't always the ability to use, if we normalize that, what they found was that everybody did better. Not just those folks who weren't using the cutting line therapy. It's really that it brings everybody up. And so in order to do something like supporting Medicaid, it isn't about just those folks who are impacted by Medicaid. It's really our population level health. And that's, to me, is the no-brainer.
Anita Aguirre has a master's in public health, and she began at Santa Cruz Community Health as the CEO in January of 2024, and has spent her career supporting community health centers and the diverse communities they serve. Her career began more than 30 years ago as a volunteer at the Women's Health Center here in Santa Cruz County. And fortunately for us, that has led her to pursue a career in health as she saw it as an extension of her feminist values. Ms. Aguirre, please.
Thank you, Congressman. So, my name's Anita Aguirre, also a banana slug. It's what brought me to Santa Cruz. And I'm the CEO of Santa Cruz Community Health, and we've been serving the community for more than 50 years. We were actually founded by a group of UCSC students just after the legislation of Roe v. Wade legalizing abortion. We operate 3 clinics, one in downtown Santa Cruz, our flagship clinic. We also have a brand new state-of-the-art clinic at Capitola Road and 17th, our Live Oak Clinic, and we have also a clinic in Ben Lomond. We have designation from the Health Resources and Services Administration as a federally qualified health center, so we are seen as part of the federally health center network, an extension of the federal government in that regards. We care for the whole family. We provide family practice, pediatrics, women's health care. We also provide behavioral health counseling, psychiatry, substance use disorder treatment, as well as optometry, chiropractic, and acupuncture. We care for more than 13,000 community members within Santa Cruz County and provide more than 90,000 visits each year. We are missioned, mandated, and regulated to serve anyone who walks through our doors, regardless of their ability to pay. And we also accept new Medicare patients, something that a number of healthcare centers within our community are no longer able to do. We are designed to serve the Medi-Cal patient population. 70% of our patients are on Medi-Cal. 10% have private insurance, 10% are on Medicare, and 10% are uninsured. And for those who are uninsured, we offer a sliding fee scale based on income and family size that slides down to 0 for your visit. As Dawn said, 1 in 3 Santa Cruzians are on Medi-Cal, but in California, 15 million people have Medi-Cal, and that's 40% of our state population. And if these cuts are rolled back to the extent to fund the $880 billion worth of cuts, we estimate that 60% of our adult patients would lose their coverage. And this would shift our uninsured rate from 10% to 40%. And if that happens, this policy change would significantly affect our ability to care for our patients who are the most vulnerable in our community. It would mean a cut to optional benefits, what they consider optional benefits, such as dental, chiropractic, acupuncture. It means cuts to our coverage that our undocumented immigrant community residents have in terms of their coverage for Medi-Cal. And it would, as Dawn was sharing, really cripple not just our ability, but the entire network within our community of healthcare. In addition to that, I will say, while not about Medicaid, the executive orders around DEI and gender-affirming care are just as dangerous.
I think there's one more thing that we need to couple with that, because you actually touched on that. 50% of all births in the state of California are on Medi-Cal. 50%. 40% of all women in the state are on Medicaid. 50% of every child that's seen in the state is on Medicaid for their care. The most vulnerable people in the state need to make sure that they have access to physicians and health care.
Thank you. Thanks to all three of you for really strengthening that whole pillar of communication, especially about the service that is so important to us, not just here on the Central Coast, not just here in California, but literally throughout the United States of America, living up to our job to make sure we communicate that, therefore you can mobilize about that when you go forward. Thanks to you three. Look forward to continuing to hear it from you. And again, thanks to all of you. We're going to get to the question and answer section right now. I have two people in the audience. Aaron, over here to my right. Emmanuel, over here to my left. Most of you know who have worked with my office, have worked with either of them. They are going to hold the mics. I know we have a lot to say. I get it. But let's try to ensure that either your statements or your questions or both are done in a efficient and timely manner so that we can get to more questions rather than fewer questions as well. And let's hope to have a civil discussion. Please, go ahead.
Thank you.
And if you could, sorry, one more request. Just state your name and where you're from.
Yes, I'm Dr. Marilyn Mariposa Bernstein, licensed acupuncturist. I want to thank you, Jimmy. I've met you several times and you've supported the LGBTQ community and the acupuncture community. So I just wrote out something real quick. That the Central California Alliance for Health, which is our county Medi-Cal, has been covering acupuncture, as Anita said as well, which has been shown to reduce pain and stress and reduce pain meds, saving lots of money, getting people back to work. As a practitioner and a teacher at 5 branches, we have gone out into the immigrant community. We have worked with farm workers that are undocumented and assisted at vaccine clinics and COVID and MPOX and so forth, and veterans clinics. We want to make sure that we keep our Central California Alliance for Health funded and not cut acupuncture, which Governor Newsom tried to take out last year, and we fought to win it, and it does save money all across the board. We work, as the health center does, with babies to seniors to veterans to firefighters. So please work to save that.
Thank you, Dr. Bernstein. Thank you for being here. Thank you for talking about that, highlighting that, but also thank you for your work out in our communities. Anybody have anything to mention about that? And also, I mean, appreciate the fact that, you know, we've met, we've talked about the benefits of acupuncture, basically educating myself about it. I appreciate that you're willing to do that and do that today as well. Please.
Yeah, just to say that I think acupuncture is also addressing our opioid epidemic in terms of also providing alternative treatment modalities for people fighting chronic pain.
Hi, me again. I want to introduce myself again. I do want to ask a question on topic that looks at where the state of California has a significant role to play. So I want to ask kind of the question around where we are and aren't able to make inroads with fighting these cuts at the federal level. The responsibility the state has to find the funds and deal with the loss of waivers, which will also have a huge impact. What are some instructive thoughts you might have for folks here in the audience for lobbying not only at the federal level, but at the state level, particularly with Newsom in mind, around the upcoming state budget and how we might be able to find funds to backfill and continue to enroll folks in Medi-Cal and other state-funded programs?
Yeah, look, thanks, Adam. Really appreciate that question. And I think that's important because you're hitting on something that's very important, that in our basically check and balance on this administration. It really takes all levels. Obviously, at the federal level, it's ensuring that our federal budget is shored up and make sure it's supported and doesn't have these cuts. Like I said, the way we do that is focus on these members who are not in the 19th Congressional District, outside of the 19th Congressional District, maybe not on the coast of California, but maybe in the Central Valley of California. That has a district that has the most recipients of Medicaid, not just in California, but in the United States of America. That representative needs to understand how important Medicaid is to his constituents. And as I've said, and I think it's true, it is going to come down to representatives like that really making a choice, and this is what we can help out, making sure their constituents, both Democrats and Republicans, go to those types of representatives that support these types of destructive cuts and basically say, are you going to be more loyal to Donald Trump and these policies, or more loyal to the constituents and the policies that help them? That is the question that they need to answer coming up. But like you said, you nailed it in regards to the state actually being a big part of this, and they are a big bulwark as well. That's why we are working with the states to basically coordinate all the litigation that's going on. And what you're seeing is that, like I said, these pieces of litigation, they're actually working a lot when it comes to that. And you'll see it on this sheet right here, that many times, the things that I listed in this below litigation, these are all pieces, these are all lawsuits where the executive orders have been stopped. That includes federal funding. We even heard a Republican senator, Susan Collins, yesterday, at least it was in today's New York Times, I was able to briefly skim, that basically she came out and said the executive branch does not have the power to determine where these congressional spending goes. And that's been stopped through litigation. A lot of what Attorney General Bonda has put forward, and will continue to do it. Now, when it comes to obviously our state representatives, look, I am lucky. You are lucky. We are lucky that we have people like John Laird, Don Addis, Gail Hellerman, who really understand what it means to fight in Sacramento, push back on this governor when they need to ensure that those cuts are not happening. And so I would recommend, they may not like this, but I would recommend you contact them as well and let them know how important it is that they stand firm when it comes to the cuts, even going against their own party, even when it comes to going against their own governor. So I think that's very, very important. But I'll turn it over to the doctors to see if they have anything to say about that lobbying effort.
Is this on? Yeah, okay. I was gonna add, I think that sometimes what helps is many people care about children's health, right? Usually you don't look at a child and say that, right? So when we reframe this, when we reframe this and think about, I'm gonna lay out a situation for you, particularly as a pediatric diabetes doctor. The rates of pediatric type 2 diabetes has been skyrocketing. And the problem that we have with this is that we don't have excellent or even sometimes effective enough treatments. So if you play this out and you think about what is the actual cost-effective analysis here, is that if we don't work on preventing and treating at a young age, the data are very clear. Again, I'm gonna only sprinkle it where it's really necessary, but it's very clear that children are diagnosed as early as in their teenage years, and they develop complications sooner than their adult counterparts within 10 years. So you're talking about dialysis centers and areas that typically see complications of diabetes that are often supported by public payers, or somewhere the burden is going to fall. And rather than showing up at 50, 60, 70, you're talking about 22, 26, 27. This is not an exaggeration because it's very clear that that's where things are going. So by ensuring access on the front end of this, ensuring that we are researching treatments, right? So that we're keeping our science as robust as possible. So we're finding new therapies. So we're keeping ourselves funded and oriented in a way where we can really prevent. We don't have to be penny wise to be pound foolish, right? That's really what this comes down to. And that's the financial argument, is you're gonna have a massive influx of needs, of chronic complications that are very, very addressable if you come on the front end.
So you mentioned waivers, and I just want to take a moment and talk about the state waiver process. So California has a very innovative program in terms of how Medi-Cal is designed, and it's also designed to not just address your physical health and your emotional health, but your social determinants of health. And so California had to apply for what's called waivers to the federal government to get them to be able to use these monies in non-clinical ways. And those waivers expire in 2026. And so it's not just about Medicaid today, it's really about the whole design of how California has said, this is how we want to care for our community. That's also on the line at the end of 2026.
I want to introduce one other thing. Excuse me. I want to introduce one more thing and one more thought to everybody in this room because I feel we're politically energized at this moment. We have to stop thinking about this, in my opinion, as the social determinants of health and really start looking at this as the political determinants of health. And that's something that's coming out of Morehouse University in Atlanta, which is a HBCU associated medical school. And why do they say that? These are choices that are made 40 years ago, 50 years ago, 30 years ago, and now. And why is it important? It's not semantical, it's actually an allocation of responsibility for those choices that are made. Why is it important? Because of the chronic disease state, because of what we see in the vulnerable populations, and those individuals that really stop and think about this is, you know, when you say social determinants of health, it sounds like a tidal wave hit somebody, or a tree fell down, or a storm occurred. No. Someone made a political choice at some point and did a political calculus and said, by taking this money from here or giving it there, or tax cuts, or whatever you want to call it, there was something that was extracted, because again, the system has to respond to that. I want us to start thinking about the fact that these are choices that are made, and we need to affect those choices in a way that helps our community and expresses our values.
My name is Ralph Lamarella. I'm here today with my stepdaughter Lily, who is a multiply disabled person at 24 years of age who needs constant 24/7 care. One of her caregivers is next to her, Sarah, and here's Marilyn, who is kind of the boss of all our caregivers. We hear about waste, fraud, and abuse constantly, never with any proof of the waste, fraud, and abuse. We know where the real waste, fraud, and abuse is that they should have started with, which is in our Department of Defense. And the CIA, which is a state within a state, as we just recently heard with the release of the JFK files. How are we going to literally fight 1,000-armed monster with a blade in every tentacle, slashing everything that's important to us, and for reasons that they cannot demonstrate are necessary, and never touch what we really need to touch to clean this government up and make it more efficient, literally? How are we going to literally do this and not just accept defeat because they outflanked us and out-talked us?
Thank you. Thank you to your daughter. Thank you, Marilyn, Sarah, for doing what you do. Really appreciate the fact that you took the time with all that you got going on to come in to make sure that you asked that question. I completely agree with you. And let me tell you, we are not giving up on this. You understand that. That's why we're here today, okay? We are not going to be outflanked. We've seen what they're doing, and unfortunately, they're doing it in a way that basically is feeding these agencies to the wood chipper. And that's why we're continuing to push back. That's why basically we're moving not only for these letters of investigation, but these resolutions of inquiry to make sure Republicans vote on them. The other day in the Ways and Means, 2 weeks ago, in the Ways and Means caucus, we basically had a hearing because we filed a motion, a resolution of inquiry, which means it has to be heard right away, about Social Security. We made every one of the Republicans vote against that when it comes to what's going on with Social Security. We will continue to do those types of resolutions of inquiry to make those Republicans basically show where they're at on these types of budget cuts, on these types of slashing and burning when it comes to Elon Musk and Doge. When it comes to Elon Musk and the Doge not coming before Congress and testifying with transparency. That's exactly what we called on them to do. That's what they need to do, and we're going to continue to pound on them to do that. Now, what it's going to come down to right now, the bulwark is in the courts, okay? That is why our system of justice, especially in the courts, is really standing firm, and they're doing just yeoman's work when it comes to pushing back on this administration. That's why if you see, once again, that's why I wanted to hand this out, all of these executive orders have been stopped because our courts have stood firm and our courts demonstrated the strength of Article 3 that basically Congress under Article 1 is not doing at this point and standing up to this administration. We're seeing it basically in talking about what's going on with these text messages. We're seeing it when it goes on with the Alien Enemies Act. This is the type of independent judiciary that we should be very proud of and continue to support despite the constant attacks that they are undergoing from this administration, despite the constant maligning that this president is doing in his courts. Because I can tell you right now, it's really about the courts and what they're holding up. Because as I talked about, being in the minority, our legislation isn't going to get heard. Our letters aren't going to get heard. But that's also why we think of those other pillars that I talked about. This type of communication, your voice, making sure that we mobilize accordingly to hold those representatives accountable come 2026. Look, I get Project 2025, okay? I'm about Project 2026, okay? You guys know what I mean by that. But in order to do that, we have to be strategic. We have to continue to fight. We have to continue to make sure our voice is heard. That's why I truly appreciate the fact that you're here, willing to highlight this and willing to bring your daughter based on everything that you have to do. If there's anything that I can do for you when it comes to your daughter or your family at the federal level, please, please contact my office. I cannot stress that enough.
We're in an emergency.
Say that again?
We are in an emergency.
I understood. I completely agree with you. I completely agree with you. And that's why we're making sure that this information is out there, especially when it comes to, like I said, you know, I get that on 2026, but we can act before that. This reconciliation package that has these cuts in it, basically we can bang on these members of Congress that are going to support these types of cuts to Medicaid. That's why I'm getting this information out there so that we can act now and not wait, especially knowing that the reconciliation package, it's going to be coming down in the next month. If not next week, we're going to start to hear more about it. So that's exactly why I'm doing these types of town halls, to get this information out there so that you can be armed with the evidence necessary to make those arguments in those other districts, so that those members in these next couple weeks, when they're faced with that vote, you know, basically are held to the fire. Look, guys, there's a reason why the president withdrew his nomination of Elise Stefanik. Because basically, one, he started to get worried about that congressional district because basically people are mobilizing. Remember, mobilization started on. Two, he's worried that they may not have the votes for the reconciliation package. Look, politically, the reconciliation package is going to be very, very difficult for them to pass, okay? Why? Because, like I said, you're going to have members that have, if they put forward these types of cuts with Medicaid, you have members with Medicaid districts, it's going to be hard for them to vote on that because of basically where their loyalties should lie with their constituents. Medicaid salt state and local tax deduction, something that I've heard from many of you on. Basically, there are members, Republican members, not just from California, New Jersey, Connecticut, where state and local taxes are through the roof. They want to get that cap of $10,000 removed. And basically, they've set their political career on that. And so you're going to see that. They have to give them that. And then three, basically, it's these debt and deficit hawks. People who say, you have these conservatives who said, I will never vote for a spending bill. Okay? I will never vote for a bill that adds to our debt deficit. That's exactly what the reconciliation bill is going to do. And so we need to show them basically how important it is that these three things are out there, important that they push back based on what they've said, who their constituents are, and show loyalty to basically who they represent and loyalty to our country, not to the President of the United States.
Thank you, Representative
Panetta. So appreciate you coming to Santa Cruz County. My name is Laura Marcus. I'm the CEO of Dianthus Community Dental Care, in case anyone's heard of us. Thank you. I want to really thank my colleagues up on the panel who recognize the importance of dental health and also the connection with so many other diseases, including diabetes, including heart disease and Alzheimer's and more. It would cost California an estimated $2 billion in additional healthcare costs if Medicaid gets cut. If Medicaid gets cut in this state. The last time this was done was in 2009, and more people suffered from infections, disease, loss of teeth. There were more emergency department visits, and there was an estimated loss of 4,500 jobs and $500 million in economic activity. My question for you is, what are your suggestions for where to find that $880 billion? What are you and the other Democrats in Congress doing and proposing to make up for that gap?
Look, what we can't do is not only have these cuts, but we can't do something that adds to our debt and deficit. What I would say is don't have cuts for billionaires. That's what I would say. That's the purpose of this reconciliation package, to extend these tax cuts for billionaires and those types of people, the donors to the Republican Party. That's what they want to do. They want to give their cronies this type of break, okay? But they want to do it by coming up with a way to pay for it, and therefore they're saying, as you saw in the budget resolution that I voted against, $880 billion that's going to have to go towards Medicaid in some way or form, based on that Energy and Commerce determination that that's what they have to cut. That's why we're speaking out again. That's why basically we got to be it known. It's not just about the cuts. It's about the reason for the cuts. And the reason for the cuts is, like I said, to give tax breaks to billionaires. And that's what we will not stand for. We got to make sure other representatives throughout the country don't stand for it as well. Like I said, that's what I'm doing to make sure not only that this constituency has that information, I'm making sure that basically other constituencies are in going forward, and making sure that we go into those districts. We talk to those other constituents and let them know. And that's happening right now, also on the unofficial side, which I can't really get into as well, but be assured that that is happening, that's being known as well. Thank you, and thanks for everything you do for Dianthus. Look forward to continuing to work with you and support you any way we can.
I have the advantage of having lived through a long time ago. I never was more than 6 months between the death of a friend from the time I was 10 until I was in my 20s. Two of them were guys that I dated. We need to start thinking about the difference between the stock market economy and the kitchen economy. And without the kitchen economy thriving, we don't have a good, strong country. That is, it's about Medicare, it's about good nutrition. I got to sit on a committee that helped design the program originally for Head Start. And one of the things that was part of that was my mother talking about, or showing me, I mean, one of the things I had to do when I was in high school was come home and bake cookies that were nutritionally dense for her classes because a lot of our kids were too hungry. So we have to take care of the human parts of things. And when we start looking at it from that is the center of everything. It's the Medicare and Medicaid is an enormous part of it, but it's the whole thing about who are we and who are we supporting? And as having a healthy country is the center of our strength. It's not about having somebody treating it like it's a football game. Anyhow, thank you.
Thank you.
I'm Peg Popkin, I'm a retired realtor.
Say your name again, I apologize.
Peg Popkin.
Peg, thank you for being here. Thank you for that question. Look, I think you're seeing, obviously, with this administration and candidate Trump, He talked a lot about, like you said, the kitchen, the economy. He talked a lot about prices. He talked a lot about the things that hurt working families, but now you're not hearing a thing about them. And like I said, you're hearing about Greenland. You're hearing about the Panama Canal. You're hearing about these types of efforts, renaming Mount McKinley, for Pete's sake. These are the types of things that he wants to distract us from those types of important kitchen table issues. We can't let that happen. We have to continue to talk about these things to make sure he addresses them. But what we're going to see is, and what we've been seeing, especially when you have an administration that is more concerned, like I said, with his billionaire cronies, those are the types of topics that he wants to talk about because he wants to distract from the important working family issues. Look, I was a big proponent of Alyssa Slotkin's rebuttal after the joint session, in which she basically said, look, we are a party about working families, supporting working families, and policies for working families, for a strong national security, and for the love and support of our democracy. Those are the three things that we have to continue to highlight as to what the minority, what Democrats stand for going forward. The way we can do that is exactly right. What types of policies support working families and not billionaires? First and foremost, we fight back on these cuts. First and foremost, we fight back on these cuts, making sure they don't happen, making sure that those Republicans in that partisan process know better and show fealty and loyalty to their constituency, not to Donald Trump. Second, we continue to put forward the policies that I'm backing here in the 19th Congressional District. Yes, healthcare policies, making sure that Medicaid is stable and supported, but also a big issue, and I had a great conversation with Jacqueline as I was walking in, Medicare. Making sure that that's properly reimbursed. Because right now, as you heard Dr. Hernandez say, it's not about coverage, it's about access. And Medicare is not reimbursing these doctors enough because it hasn't kept up with inflation. And so I'm working on a bill, bipartisan bill, to make sure that it is. And so we're doing that. That's a big thing. And then of course, supporting the Affordable Care Act as well, making sure that basically people not just have that coverage, but people have access under the Affordable Care Act. Second way where I'm focusing on another priority in this district, affordable housing. Making sure that people basically have a place to live and can do it, exactly. Because basically, that, as I talked about our congressional district, how diverse it is, how spread out it is, that really is the issue that kind of brings it together. Because when you have Santa Cruz County as the most expensive place in the nation to rent an apartment, that's ridiculous. When you have the average median price for a single family home at over $1 million, that's unfair. We get a lot of people who work here, who support us, who serve us. Unfortunately, they're not able to live here. They spend too much damn time in their cars and not with their families because they have to live out of the congressional district. And so we want to make sure that we have affordable housing here as well. That's why I'm working on legislation to ensure that basically we do that. Low-income housing tax credits, middle-income housing tax credits, as well as making sure we have the first-time homebuyers tax credit and making sure that we double the capital gains tax exemption. I'm talking about policies that are helping us. And I'm sorry you don't like it, but that is what I do, and I look forward to continuing to work on those. So thank you for bringing that up. I mean,
I just want to say thank you so much, Representative Panetta. We had a chance to actually meet last year when I was on Congressional Hill advocating with the AAP, the American Academy of Pediatrics. My name is Dr. Carmen Powell. I'm a pediatric hospitalist here at Watsonville Community Hospital and medical director for the last 7 years. I've actually worked in the trenches with our community hospital and serving a very rich, diverse immigrant population. And one thing that I feel like has been missed from this conversation, you do talk about the family and those hardest workers, but I feel like that's our immigrant community right here in Santa Cruz County, all relegated to South County, which unfortunately is not within your district, but really needs a lot of advocacy from this district because of the advantages and the privileges that we have and making sure we're upholding that and supporting this community because they are the rock bed of the United States of America in terms of the Medi-Cal population, but also in terms of the healthcare workforce when it comes to physicians, surgeons, scientists, researchers, all of those different fields are really within the immigrant population are part of. So what is your kind of like piece about how do we support those communities as well as even from here within the county. I think there's a piece where I often miss that in our conversations. I know we do a lot to serve this population, but how can we mobilize to make sure we're protecting those who are very scared when it comes to threats of immigration and ICE that's currently happening? And how do we make sure that we are being strong advocates for that community, especially when it affects women and children, which I serve very closely.
Better angle on what you guys talked about, the local level. Look, I completely agree with you. Obviously, I'm so proud that this is the only place I've called home in the family that I came from. An Italian immigrant family that came here, played by the rules, and basically was able to get ahead. Unfortunately, we have way too many people that want to continue to live that American dream and they don't have these opportunities. And not only that, they're being constantly attacked by this administration, because this administration has absolutely no idea the contributions of our immigrant community here on the Central Coast, to our economy, to our society, to our humanities, to what we stand for in the 19th Congressional District. At the federal level, we got to do, our immigration system is absolutely broken, okay? We know that, and it's pathetic that we haven't been able to do anything on it since 1996, 1986, when we passed our last substantive immigration reform bill, comprehensive immigration reform bill. Yes, of course, we support border security, but we got to support those immigrants that continue to contribute to what we stand for. We got to support our dreamers and our DACA recipients. We have to support our farm workers with the Farm Workforce Modernization Plan. We have to come together in a bipartisan basis to ensure that we pass immigration reform and that those TPS recipients can stay here as well, which we have a big community here too. So we got to do a better job in Congress. I've been working on it ever since I came into Congress. Immigration reform is the most politically complicated, policy complex issue that I have worked on. I'm telling you that, but it takes a type of political will to do it. Fortunately, based on where I come from, who I am, the district that I represent, I'm going to continue to work on this. We're actually having discussions right now about it. Now, that's why we need to step up at the local level, which you do, Dr. Powell, and we have so many organizations that help our immigrants and our immigrant community, especially when it comes to either housing, healthcare, and all those other important issues that we basically have value here on the Central Coast. I'm going to turn it over to the doctors because I'm sure they have more to talk about when it comes to on-the-ground services for our immigrants.
Thanks, Dr. Powell, for raising that really important point. And I think you actually said it perfectly what the solution is, which is that we should be mobilizing those of us who hold privilege wherever we do to leverage that to come in. So I think at one of the other town halls, someone came up to me at the end and said, I'm debating between curling up into a ball or getting really angry and doing something. Which one should I do? And I was like, do something. And so what is the do something? The do something is, navigating a healthcare system is really complicated. So if you want, volunteer at the local hospital and say, hey, I'm happy to, is there a program in place where I can help folks move through the medical route from one room to the other, or from one side of the building to the other? Oh, that's where billing is. That's where you need to get your x-rays. There's volunteer programs in place if health is where your passion is. There are clinics that are looking for additional support as we're getting more and more understaffed. There are places where people are looking for your time, care, love, energy, sometimes money. Go out to where it aligns with what matters to you and where you can really make an impact for these families, because I think the needs are huge. Anything as simple as diapers, those are a standard cost that every new family has to incur. If you want to buy a bunch of diapers and give it to families, that actually makes a huge difference. And then for example, at the Monterey Clinic, we go out of our way to really make sure that families know that they're safe there, where their rights are. And so getting the word out about what is your right. You don't have to open the door for anyone. You don't have to sign anything, and really making sure that all of us who hold whatever iota of privilege we do, leverage it, share it, spread it, and get it out there. So thanks for elevating this.
I think the one thing we have to recognize also is we're sort of looking at a new paradigm. This is an entirely different thing with respect to our essential agricultural workers. The example that I think of is what happened in Kern County, where individuals were targeted by Immigration and Naturalization Service on their way to pick fruit. Those messages are going to be reverberated through the community in ways that we're not going to even see through social media, through a friend or a cousin talking. That's what my people do. We talk to one another in ways It's very, very interconnected. Part of that is also understanding and respecting those interconnectivities in those communities and how they communicate with one another, and working in a way that doesn't necessarily draw attention to them, but also understands at the same time that the precarious position they are is really going to be impacted by what we do and what choices we make. So your point, find those areas that you can assist, maybe with the Farm Bureau, maybe with farm worker organizations, maybe understanding the immigrant population. And it goes beyond just agricultural workers, but we have people in the domestic industry, we have people in the food service industry, we have individuals working in construction, but understanding that we're working within those communities in a very community-centric way that's really attentive to how they get their information in terms of how they access services becomes incredibly important, I think.
Representative Panetta, you said the Republican Party must be held accountable for passing the CR that has caused this Social Security and healthcare crisis. However, you defended Chuck Schumer for averting a government shutdown, which he did by passing the bill despite the fact that you voted against it. My question is, do you believe Chuck Schumer betrayed the Democrats and your constituents, and will you hold him as accountable as the Republicans? Sorry, my name is Christian Jeske. I'm local here from Aptos.
Outstanding. Thanks, Christian. Thank you for being here, and thanks for asking that question. Understandable question, and that's why I addressed it in my initial remarks. Because I think it's important to talk about that. Basically, first and foremost, I voted no, and I explained why I voted no. Because, like I said, Republicans failed to negotiate. There were serious cuts in there. Didn't have disaster relief, and like I said, it gave the executive branch more power to spend, unfortunately. And so I made sure to vote no. But like I said, Chuck Schumer was faced with a dilemma that he should have stood up for. He should have basically come down early on and messaged where he was at. His problem was he didn't know how to talk about this bill. And that was the predicament that he got stood in, and that basically, and then, now whether or not he's going to lead, he doesn't lead the Democratic Party, let's be clear about that. He leads the Senate. Therefore, it's going to be up to the Senate. And what I've heard in my discussions with senators and my Democratic senators, and having these types of conversations about where are you going to go after that type of debacle of a decision that was made, that type of debacle of messaging that was going on. What's going on there? Their response was, look, it was a tough issue. It was a predicament. You know where I voted, and that's where we're going to go forward. We need to make sure that we have the proper messaging and the proper leadership, be it in the Senate or be it in the House or overall in the Democratic Party. Look, I'm in the United States House of Representatives, and Hakeem Jeffries is our leader, and I'm proud to say that I voted for him for Speaker a number of times, and I will continue to vote for him a number of times. But we as Democrats have to understand that we have to have basically stronger messaging. And now I'm getting to the unofficial side of things, and I don't want to go there too far, but I'm just telling you, we understand that there needs to be, especially after the last election, there needs to be some self-scrutiny, there needs to be humility, but at the same time, we have to do a better job telling you how we can provide that unity and making sure, let me finish, making sure that we come together. And like I said, there was this muzzle velocity. I admit, trust me, I admit, you guys know me, I'm pretty honest when it comes to this stuff. I admit we were knocked on our heels a little bit coming out of the chute, okay? But clearly, based on the town halls that I've done, the messaging that I've done, the information that I'm getting out there, hopefully you understand and know where I'm at when it comes to what we need to do going forward in order to actually do something to push back on this administration, to fight back on this administration, in addition to my services to the 19th Congressional District. So the way I look at it is, you can have your leaders in the Senate, in the House, but let me tell you, I'm here to lead and serve the 19th Congressional District, which I will continue to do to ensure that we here in the 19th Congressional District get our message out there through my communication, through our mobilization, so that we can win in 2026. That's what it comes down to. Ladies and gentlemen, I want to thank you. I said we'd go from 9 to 10.